My name is Mpopi Lenake, which is a Sotho name. So the way it's spelled is not the way it's pronounced, which is confusing for a lot of people. So the O is pronounced like a U. Various people have different ways of remembering how to say my name. Some are very rude, but anyway, it's fine. I am a medical doctor by profession. I live in the Western Cape in the town of Somerset West. I am an ophthalmologist, which is an eye specialist. I operate on eyes, I treat eye conditions, and I have a special interest in ophthalmology, in oculoplastics, which is the medical and surgical management of conditions that affect the eyelids and the surrounding areas. Yeah. So why did I become an ophthalmologist? Well, why did I become a doctor actually? My father is a doctor, so I've been exposed to medicine all my life, but he worked very, very hard, still does, and I didn't want to be as busy as he is, first of all, but when I got to medical school, I discovered ophthalmology, and I love how there's a great mix of surgery and medicine in ophthalmology, and a lot of the patients are not so ill, they're well, and the treatments that you give are life-changing. Many are life-changing. So that's the main reason. And during my training in ophthalmology, I discovered oculoplastics, which is my special interest, my subspecialty, which involves the medical and surgical treatment of eyelid and surrounds, any conditions involving affecting those areas. And that is also a nice mix of ophthalmology, so treating eye conditions, but also a little bit of plastic and reconstructive surgery, which is also something that I'm fascinated with. I think that it's important to keep abreast with technological advances. And so that's one of the reasons why I moved and I wanted to do my own thing. I also have my own way of doing things, and I felt like if I was in my own space, I'd be able to do more of that. This was never my intention, but I know there are a lot of other women who look like me, who are encouraged when they see the things that I do. So even as worried and as scared as I feel about making some of these bold decisions, I feel like, there are people behind me that are watching that are also encouraged. And this area that I practice in is it doesn't have a lot of people who look like me in this type of position. So I think it's important for everybody who comes here to know that it's possible, and it should be the norm. So that's one of the reasons why. Okay, so believe it or not, the eyes are actually part of the body. So if you have some sort of disorder in the body, often you can see it in the eyes. So for example, if you are a diabetic and you've got damage of your blood vessels from the diabetes, you can see that in the eyes. A lot of other conditions affect eyes, as I've mentioned, so it's important to look after your general well-being and your eyes. And without good vision or visual function, you cannot function well in life. So if you can't see well, you can't drive, you can't read, you can't work, you can't participate in general activities of daily living, and then you become dependent on others. So it is very important. I think in general, patient education is always important, because when people know better, they do better, and they can meet you halfway and they can take ownership of their problem. And I think we're living in an era where there's a lot of information out there and a lot of misinformation as well. So the correct information should be coming from healthcare providers. So I think it is important to educate patients, and also it's good for the entire medical community. If I create a good rapport with the patient and they trust me, they trust the system as well, and so the next medical person is going to be at an advantage as well.